Did you know that pancreatic cancer is often called a silent killer because its symptoms can be vague and easily overlooked, making early detection super challenging? Today, we're diving into a serious topic, pancreatic cancer. It's often called a silent killer. And for a good reason. See, the symptoms can be pretty vague and easy to brush off. You might think it's just a stomach bug or something you ate, but these seemingly harmless signs could be your body trying to tell you something's wrong. Yeah, well, early detection is key with any cancer, but it's especially crucial with pancreatic cancer. The earlier we catch it, the better the chances of successful treatment. So let's break down 12 symptoms you absolutely shouldn't ignore. Stay tuned, because being informed could potentially save your life or the life of someone you love. Have you ever noticed your clothes fitting looser, but you haven't been hitting the gym any harder? While sometimes it's a good thing, sudden, unexplained weight loss is a major red flag. We're not talking about dropping a pound or two. I mean a significant and unintentional decrease in your weight. If you're not actively trying to lose weight and you're dropping pounds rapidly, it's time to see your doctor. Pancreatic cancer can mess with your metabolism and how your body processes nutrients, leading to weight loss. Now, don't jump to conclusions if you lose a few pounds, but if it's significant and unexplained, get it checked out. Trust me, it's always better to be safe than sorry. Ever wake up and think your skin looks a little yellow? You might even notice your eyes taking on a yellowish tint too. This, my friends, is called jaundice. It happens when a yellowish substance called bilirubin builds up in your blood. While there are a few reasons why this might happen, jaundice can be a sign of pancreatic cancer. See, the pancreas is responsible for producing enzymes that help with digestion, including breaking down bilirubin. When a tumor grows in the pancreas, it can block the bile duct, which is responsible for transporting bilirubin from the liver to the intestines. This blockage can cause bilirubin to back up into the bloodstream, resulting in the yellowing of your skin and eyes. Now let's talk about abdominal pain, a symptom many of us experience for various reasons. But when it comes to pancreatic cancer, the pain is often persistent and located in the upper abdomen, right where your pancreas sits. Imagine a dull, gnawing ache that just won't quit. It can radiate to your back, making you think it's just muscle pain. But trust your gut, literally. If you're experiencing this type of pain, especially if it's new or worsening, don't brush it off. Remember, early detection is key with any cancer, and pancreatic cancer is no exception. Don't hesitate to see your doctor, get those symptoms checked out, and rule out anything serious. Have you ever noticed a sudden and unexplained decrease in your appetite? It's normal to have days when you're not as hungry, but if you're consistently feeling full quickly or have no desire to eat, it's worth paying attention to. Loss of appetite, especially if it's accompanied by unexplained weight loss, can be a red flag for pancreatic cancer. This happens because the tumor can interfere with the production of digestive enzymes and hormones that regulate hunger. Think of it like this. Your appetite is like a signal from your body telling you to refuel. But if the signal is weak or absent, it could mean something is disrupting your body's normal processes. Let's talk about nausea and vomiting. We've all experienced these unpleasant sensations at some point, often due to a stomach bug or food poisoning. But when these symptoms become persistent and are accompanied by other red flags, it's time to dig deeper. In the case of pancreatic cancer, nausea and vomiting can be caused by a tumor obstructing the digestive tract or interfering with the production of digestive enzymes. Imagine a traffic jam in your gut, preventing food from moving through smoothly. This blockage can lead to a buildup of food and digestive fluids, triggering nausea and vomiting. It's like your body's way of trying to hit the reset button on your digestive system. Yes, we're talking about your stool, your poop, your bowel movements, whatever you want to call it. This is something we all do, but not many of us like to discuss. However, understanding your stool stool can provide valuable insights into your overall health and well-being. And listen, we're about to get real about something we all do, but don't always love to talk about poop. It's a natural part of life. And believe it or not, it can tell you a lot about what's happening inside your body. So let's break the taboo and get comfortable with this conversation, because it could make a significant difference in your health. Yes, those bowel movements can actually reveal a lot about what's going on inside your body. From the color and consistency to the frequency and smell, each aspect of your stool can provide clues about your digestive health and more. It's like a report card for your gut, and paying attention to it can help you catch potential issues early. And when it comes to pancreatic cancer, paying attention to changes in your stool can be crucial. The pancreas plays a vital role in digestion by producing enzymes that help break down food. When something goes wrong with the pancreas, it can affect your stool in noticeable ways. Early detection is key, and your stool can be one of the first indicators that something might be off. So, what changes should you be looking out for? There are several signs that could indicate a problem with your pancreas or other parts of your digestive system. By being aware of these signs, you can take proactive steps to address any issues and seek medical advice when necessary. Well, one of the most common signs is a change in the color of your stool. Normal stool color can range from various shades of brown depending on your diet and other factors. However, if you notice a significant change, especially to a pale or clay color, it could be a sign that something is not right. If you notice that your stools are pale or clay colored, that could be a red flag. This change in color can indicate that your pancreas isn't producing enough of the enzymes needed to break down fats, which can lead to those lighter colored stools. It's a signal that your digestive system might not be functioning as it should. It could mean that your pancreas isn't producing enough of the enzymes needed to break down fats, which can lead to those lighter colored stools. These enzymes are crucial for proper digestion, and without them, your body can't absorb nutrients effectively. This can lead to malnutrition and other health issues if not addressed promptly. Another thing to look out for is the consistency of your stool. Normal stools should be soft and easy to pass, but if you notice a change in consistency, it could be a sign of a problem. For example, if your stools become very loose or watery, it could indicate an issue with your digestive system. If your stools become greasy or oily and seem to float in the toilet bowl, that could also be a sign of pancreatic problems. This type of stool, known as steatorrhea, occurs when your body isn't absorbing fats properly. It can be a sign that your pancreas isn't producing enough enzymes, or that there's a blockage in your bile ducts. Remember, these changes could be due to a number of things, not just pancreatic cancer. Other conditions such as gallbladder disease, celiac disease, and chronic pancreatitis can also cause changes in your stool. That's why it's important to pay attention to any persistent changes and discuss them with your doctor. But any noticeable and persistent changes in your bowel habits are always worth bringing up with your doctor. Your doctor can help determine the cause of these changes and recommend appropriate tests and treatments. Early detection and intervention can make a big difference in managing any potential health issues. Now, I know these conversations can be a little uncomfortable, but trust me, your doctor has heard it all before. They are trained to handle these discussions with sensitivity and professionalism. Don't let embarrassment prevent you from seeking the help you need. Your health is too important to ignore. And when it comes to your health, it's always better to be safe than sorry. Taking the time to monitor your stool and discuss any changes with your doctor can help you catch potential issues early and take steps to address them. It's a simple but effective way to stay on top of your health. So next time you're in the bathroom, take a moment to check in with your body and pay attention to what your stool is telling you. It might seem like a small thing, but it can provide valuable insights into your health. Don't be afraid to have these conversations with your doctor and take charge of your well-being. Your body will thank you for it. We're talking about pancreatic cancer, and there's another surprising symptom that you should be aware of: diabetes. This connection might not be immediately obvious, but it's a crucial one to understand. Pancreatic cancer is a serious and often deadly disease, and recognizing the signs early can make a significant difference in outcomes. One of those signs, surprisingly, can be the onset of diabetes. Now, I know what you're thinking. What does diabetes have to do with pancreatic cancer? It's a valid question. After all, diabetes is typically associated with issues like obesity, poor diet, and lack of exercise. But the relationship between diabetes and pancreatic cancer is more complex and intertwined than you might think. Well, it turns out there's a strong link between the two. Studies have shown that a significant number of people diagnosed with pancreatic cancer also have diabetes. In some cases, diabetes can be an early warning sign of pancreatic cancer, appearing months or even years before the cancer is diagnosed. You see, your pancreas plays a vital role in regulating your blood sugar levels by producing insulin. Insulin is a hormone that helps your body use glucose for energy. Without enough insulin, your blood sugar levels can become dangerously high, leading to diabetes. The pancreas is a small organ located behind the stomach, and it has two main functions: producing digestive enzymes and regulating blood sugar. When your pancreas isn't functioning properly, whether due to cancer or another condition, it can't produce enough insulin, leading to a buildup of sugar in your bloodstream. This is why people with pancreatic cancer often develop diabetes. The cancer can interfere with the pancreas's ability to produce insulin, causing blood sugar levels to rise. This can happen even if the person has never had diabetes before. And that, my friends, is what we call diabetes. Diabetes is a condition where your body either can't produce enough insulin or can't use the insulin it produces effectively. This leads to high blood sugar levels, which can cause a range of health problems if not managed properly. Symptoms of diabetes can include increased thirst, frequent urination, fatigue, and blurred vision. Now, it's important to note that not everyone who develops diabetes has pancreatic cancer. Diabetes is a common condition, and most cases are not related to cancer. However, the link between diabetes and pancreatic cancer is strong enough that it should not be ignored. If you develop diabetes suddenly and without any obvious risk factors, it's worth discussing with your doctor. In fact, most cases of diabetes are type 2 diabetes, which is often linked to lifestyle factors like obesity and inactivity. Type 2 diabetes is the most common form of diabetes, and it usually develops in adults over the age of 45. It's often associated with being overweight, having a poor diet, and not getting enough exercise. However, type 2 diabetes can also develop in younger people, especially if they have a family history of the condition. However, if you're diagnosed with diabetes later in life, especially if you don't have any of the usual risk factors for type 2 diabetes, it's essential to talk to your doctor about the possibility of pancreatic cancer. This is particularly important if you experience other symptoms of pancreatic cancer, such as abdominal pain, jaundice, or unexplained weight loss. Early detection of pancreatic cancer can significantly improve your chances of successful treatment. Early detection is crucial when it comes to pancreatic cancer, and a new diagnosis of diabetes could be an important clue. Pancreatic cancer is often diagnosed at a late stage because its symptoms can be vague and easily mistaken for other conditions. By paying attention to changes in your health and discussing them with your doctor, you can help ensure that any potential issues are caught early. So, if you're experiencing any symptoms of diabetes, such as increased thirst, frequent urination, unexplained weight loss, or blurred vision, please don't ignore them. These symptoms can be signs of diabetes, but they can also be indicators of other health issues, including pancreatic cancer. It's always better to be safe and get checked out by a healthcare professional. Schedule an appointment with your doctor and get checked out as soon as possible. Your health is too important to ignore. By staying informed and proactive about your health, you can catch potential problems early and take steps to address them. Remember, early detection can make all the difference when it comes to serious conditions like pancreatic cancer. All right, let's talk about another symptom of pancreatic cancer that you might not expect: blood clots. Blood clots, medically known as thrombosis, are clumps that occur when blood hardens from a liquid to a solid state. While they are a natural part of the body's healing process, they can also be a sign of something more serious when they form inappropriately. Now, you might be thinking, blood clots, what do those have to do with my pancreas? It's a valid question because at first glance, the pancreas and blood clots seem unrelated. The pancreas is an organ that plays a crucial role in digestion and blood sugar regulation, while blood clots are typically associated with cardiovascular issues. Well, it might surprise you to learn that there's a connection, and it all comes down to the way cancer can affect your body's natural clotting mechanisms. Pancreatic cancer, in particular, has a unique way of interacting with your body's systems. See, pancreatic cancer, like some other cancers, can release substances into your bloodstream that make your blood more likely to clot. These substances, often proteins or other molecules, can disrupt the delicate balance of your blood's clotting system. These clots can form in your legs, arms, lungs, or even your brain, and they can be extremely dangerous, even life-threatening. For instance, a clot in the leg, known as deep vein thrombosis, can travel to the lungs, causing a pulmonary embolism, which is a medical emergency. Now, it's important to remember that blood clots are not always a sign of pancreatic cancer. They can occur for many reasons. And not every blood clot is They can be caused by a variety of factors, including genetics, lifestyle, and other medical conditions. For example, prolonged immobility, such as during long flights or bed rest, can increase the risk of clot formation. Certain genetic conditions can also predispose individuals to clotting disorders. However, if you experience unexplained swelling, redness, or pain in your limbs, especially if it's accompanied by shortness of breath, chest pain, or difficulty speaking, it's crucial to seek immediate medical attention. These symptoms could indicate a serious clot that requires prompt treatment. These could be signs of a blood clot, and prompt treatment is essential to prevent serious complications. Blood clots can block blood flow to vital organs, leading to damage or even death if not treated quickly. Remember, time is of the essence when it comes to blood clots. So don't delay seeking help if you experience any of these symptoms. Early intervention can make a significant difference in outcomes, potentially saving lives and preventing long-term health issues. So always be vigilant and proactive about your health. We're continuing our look at the 12 symptoms of pancreatic cancer. And in this chapter, we're tackling a symptom that can be pretty common and easily brushed off: fatigue. Now, everyone gets tired from time to time, right? Life's busy. We work, we play, we barely sleep. But There's a difference between everyday fatigue and the kind of fatigue we're talking about here. The fatigue associated with pancreatic cancer is often persistent, unexplained, and can significantly impact your quality of life. Imagine feeling like you've just run a marathon, even though you haven't even left the house. You're constantly drained, no matter how much sleep you get. This extreme tiredness can be due to a number of factors related to pancreatic cancer, such as the tumor itself putting stress on your body, poor nutrient absorption due to the pancreas not functioning properly, or even anemia, which is a common complication of the disease. So if you're experiencing persistent, unusual fatigue that doesn't go away with rest, it's crucial to bring it up with your doctor. Let's talk about another symptom of pancreatic cancer that often gets mistaken for something less serious: back pain. We've all experienced back pain at some point in our lives, whether it's from sitting at a desk for too long, lifting something heavy, or just sleeping in a weird position. But the back pain associated with pancreatic cancer is different. It's typically located in the upper back, right around the shoulder blade area, or deep in the abdomen, and it can radiate to the back. This pain is often described as a dull, aching sensation that's constant and doesn't improve with over-the-counter pain relievers. Why does this happen? Well, the pancreas is located deep in the abdomen, and as a tumor grows, it can press on surrounding organs, nerves, and even the spine, causing pain that radiates to the back. In some cases, the cancer may even spread to the bones in the spine, leading to severe back pain. All right, guys, who knew itchy skin could be related to pancreatic cancer? It sounds strange, but it comes down to your liver. See, when your pancreas isn't working correctly, it can affect your liver's ability to function properly. One of the liver's jobs is to filter out waste products. And if it can't do that effectively because of a pancreatic tumor, these waste products can build up in your blood. This buildup can lead to itchy skin, a condition called pruritus. Now, I know we all get itchy skin from time to time, whether it's dry skin, an insect bite, or an allergic reaction. But if you're experiencing persistent itching, especially if it's all over your body and not just in one specific area, it's crucial to get it checked out. Don't ignore it thinking it's just dry skin. It could be a sign of something more serious, like impaired liver function, potentially related to pancreatic cancer. Early detection is key, so let's address any concerns head on. Ever noticed your urine looking a bit dark, almost like cola? While it could be dehydration, certain medications, or even some foods, it can also be a sign of something more serious, like pancreatic cancer. I know another symptom that seems unrelated, but stay with me here. Remember how we talked about jaundice and how it turns your skin and eyes yellow? Well, dark urine is another sign of jaundice. The culprit behind both of these symptoms is a substance called bilirubin. Bilirubin is a yellow pigment that's produced when red blood cells break down. Normally, it's processed by the liver and excreted in bile. But when the pancreas isn't functioning properly, it can block the bile duct, preventing bilirubin from leaving the liver. This buildup of bilirubin in the bloodstream is what causes jaundice and the characteristic dark urine. Wow, we covered a lot of ground today. We talked about 12 potential symptoms of pancreatic cancer: unexplained weight loss, jaundice, abdominal pain, loss of appetite, nausea and vomiting, changes in stool, new onset diabetes, blood clots, fatigue, back pain, itchy skin, and dark urine. Now remember, experiencing one or two of these symptoms doesn't automatically mean you have pancreatic cancer. Many of these symptoms can be caused by other less serious conditions. But if you're experiencing several of these symptoms, especially if they're persistent or worsening, it's crucial to see your doctor. Early detection is key when it comes to pancreatic cancer. The earlier we catch it, the better the chances of successful treatment. So please, if you're concerned, don't hesitate to reach out to your healthcare provider. I hope this video was helpful for you guys. If you have any questions or comments, please leave them below. And if you know anyone who might benefit from this information, please share the video with them. Don't forget to subscribe for more videos about staying healthy and living your best life. Until next time, stay happy and healthy.